Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Stephen Newmark, Chief Policy Officer at the Global Healthy Living Foundation.
And I'm Zoe Rothblatt, Director of Community Outreach at GHLF.
Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life.
And speaking of the healthcare world, it's definitely been a busy start to the second administration of President Trump. There's been lots of executive orders, proclamations, and declarations. So we have a bunch to touch on. And today, we'll focus in our sector about, what impacts health and healthcare and what pertains to our community.
Yeah, that's right, Zoe. It has been a heck of a first week. Let's start by saying President Trump has made a lot of announcements. Some are official actions, some not so much. As of this recording, I believe that there have been 23 executive orders signed so far. Hopefully, in all the flurry, there will be some policies that you will cheer and perhaps others that you may not like. For those that you do like, great. And for those that you find troubling, it can be difficult to digest how to respond. If you're listening to our show, you probably have some inkling towards advocating for the patient community and thus the desire to seek change where we see fit. So towards that end, our advice on all that has happened is to, if you're dispirited, is pick your battles.
Right. Yeah, we mentioned a few things, so maybe we'll get started by just explaining some of the lingo, because there's been general statements, executive orders, and actual legislation. So let's start with general statements. This isn't really enforceable by law, but of course that could have an impact on just public sentiment and feeling towards what's being said and how people can react based on that. Legislation, once passed and signed by the president, these are the laws of the land unless they're found unconstitutional. And then now we've been hearing a lot about executive orders, and this has been, you said 23 of them as of this recording. This is the crux of what we're talking about today.
Sure. Yeah. An executive order is a directive issued by the president that manages operations within the federal government. It carries the force of law, but does not require approval from Congress. So again, it has the force of law, but it's limiting in that executive orders cannot override laws passed by Congress, nor can they violate the Constitution. Courts can review executive orders and invalidate orders that are deemed to be unconstitutional or exceeding presidential authorities. The most famous example of an executive order was I think the most famous example would be the Emancipation Proclamation, which in 1863, Abraham Lincoln used to declare the freedom of slaves in Confederate states.
I would definitely agree. If you asked me what's a famous executive order, I'd probably say that one too.
Well, let me ask you this. Did you know it was an executive order before we did the show?
Probably not. I guess I would say it's a proclamation since that's in its name.
Right. Me neither. I didn't know that either, to be fair. So a little research before the show, and look what we found.
So what's been happening in week one of this new administration?
We said it's a lot. I think this comes directly from the administration itself. They're employing what they're calling a shock and awe moment, if you will, putting out a lot of stuff in one place. And perhaps if all of these executive orders, these proclamations, these statements were being made over the course of 12 months, it would feel a little bit differently. You would be able to absorb them individually. But because so much is happening at once, it is a bit overwhelming, to say the least. And there is a fair amount that really do touch on healthcare policy. Some impact healthcare directly and some indirectly. So we'll talk about some of them. We just don't have the bandwidth to get to all of the changes. But let's start with one that is directly related. Trump rescinded a Biden executive order that was aimed at lowering prescription drug costs.
Yeah, so that Biden order had directed the Secretary for the Department of Health and Human Services, HHS, to consider and test new healthcare payment and delivery models that would lower drug costs and promote access to innovative drug therapies for beneficiaries enrolled in Medicare and Medicaid. So CMS had been planning to do stuff. It hadn't actually taken effect, I'm pretty sure. So, I'm not sure if we'll see too much of an impact from the rescinding of this order aside from, those plans won't happen now.
Right. Yeah, I think that's fair to say. I saw this particularly got a lot of play in the health policy media, I guess you would call it. But as you said, the actual Biden executive order, other than work being prepared by staffers at CMS, hadn't gone into action. So the average person is not going to feel anything different.
Also, something to note that we've been talking about a lot is the Inflation Reduction Act, the IRA. And from what I saw, that $35 cap on insulin and the $2,000 annual out-of-pocket cap on prescriptions is not being touched right now. That seems to still be in effect. And also that Medicare still has the authority to negotiate drug prices under the IRA. So I guess we'll see how that might be impacted or not.
Yeah, those would be tough to overturn. Those are actual laws. So, as we said up top, to an executive order or declaration by the president cannot override laws passed by Congress. So we'll see how that plays. If the IRA or other laws that were passed are something that President Trump is going to want to get into. Before we move on, I just want to say it's not clear why Trump issued this executive order. There was not much discussion around a lot of the signings, but in this one, I didn't see much rationale for the signing. It doesn't mean I don't say that in a good way or a bad way, just in a more factual way. It sounds like a somewhat benign executive order that Biden had put into effect, look into ways to lower drug prices. And now he's just rescinded that. But, we'll see what that means going forward. We'll see if he comes up with his own executive order aimed at lowering drug prices and go forward from there.
And then, I guess the next on the list is something that was a little more predictable, which is about rescinding some orders around the ACA, the Affordable Care Act. We've heard about a lot in Trump's first term about attacking the ACA, and these were revoking some of Biden's executive orders that expanded access to the ACA.
Yeah, this is really getting into the weeds, so I'll try to keep it high level. But this one, the Biden executive order, allowed particularly parents with young children to gain more eligibility for more extensive coverage. This is what health policy experts call the, quote, family glitch. Before the executive order, for example, if a spouse's employer offered family coverage, you were ineligible for a marketplace plan. So, for example, a friend of mine, her husband's employer was offered family coverage for a very high cost in relation to his salary, but because his individual coverage was affordable, that made him ineligible for the Affordable Care Act. So this essentially allows a greater number of folks to shop for family plans, or had, I should say, past tense. And it seems to have been a very popular executive order for those who took advantage, and it did help increase enrollment numbers.
And the other one related to the ACA was Biden had expanded enrollment periods, so it was just like a longer time to enroll, and also funding for signing up for plans was increased. So I saw that nearly doubled ACA enrollment to 24 million. So I could imagine this rollback of those orders would significantly reduce enrollment in the ACA. And I guess we'll see that next year because open enrollment has closed for this season, right?
Right. This is another one. I'm not sure why this was done. Trump has a personal distaste for sure of the Affordable Care Act, otherwise known as Obamacare. But again, there was a little discussion that surrounded these signings, so it's hard to understand their full purpose or policy rationale behind it. Look, you can't, in terms of sign-up dates and availability, we do want to set parameters, and maybe there is a rationale for having expanded it for Biden or for limiting it. But again, it wasn't provided concomitantly with the signings, so it's unclear right now.
Yeah, like if I'm trying to make sense of it in my head, maybe it was like, okay, we expanded this during like the big threatening time of COVID.
Good point.
When, we needed, like everyone needs to be on insurance all the time, in my opinion, but especially then when you have such a big public health threat, and maybe it was like, well, now that that's circulating and more, we have a better understanding of the way it circulates, etc. Maybe now it's time to reduce health insurance, which I don't particularly agree with, but I guess maybe that's how I can make sense of it.
Right. All right, another one. The Trump administration ordered a full pause on external communications from federal health agencies. So this includes the CDC, the FDA, the NIH, and even MMWR, mortality and morbidity weekly reports. So I believe last Friday there was no issuance of an MMWR report, which is a rare thing to have happen. And also HANS, and I forgot what HANS stands for, but I know it has to do with emergency alerts. So there's a pause going on.
And there are exceptions for communication for like critical health and safety, but they are subject to review. So I guess that could delay the communications a bit. I know it isn't like totally out there for an incoming administration to pause communications. This does seem to be temporary, but we'll have to see, after this full pause, like how stuff is filtered through and posted and disseminated to us afterwards. So it's like another one of those wait and see, I guess.
Yeah, I think that's a fair assessment. This is another one where I see a lot of discussion in the health policy, social media/media world. But I agree. I think let's wait and see what this actually means. It's not that unusual for a new administration, from mayor to governor to president, to put a pause on communications from agencies to get their handle on how they want to address the public.
Yeah, and I also kind of wonder if like a smoother transition between administrations could have maybe reduced some of this pause.
Probably.
As we see with the rescinding of the executive orders, it's like a really different position and mentality. So it seems like there's like a big pause and a big switch. So all I'd say is like it's a pretty harsh transition and we'll see what's coming next.
Yeah, you would think just from a practical standpoint, if you're coming into a new administration and you didn't like the way the previous administration was doing something, you would sort of at least continue on, particularly when dealing with matters of health and science, while you try to figure out a more ideal way, rather than say, hey, we're going to stop everything that's been going on for decades, and then we're going to come up with a new way of doing things. It does seem more natural to say, either have your plan ready to go, or, as I said, develop your plan while not putting a pause on what has been the norm for decades with agencies, and particular agencies that deal specifically, as I said, with science, data, public health, things that should not be controversial. But anyhow.
Yeah, definitely. It feels like we have a right to that health information, right?
Yeah, certainly you want to know. And there is an emerging public health threat, knock wood that it doesn't develop further, but there is the H5N1, that's the bird flu, which seems to be growing. So you want to know what's going on, or some folks do want to know what's going on. I know I'm one of the people that would prefer to know rather than not know.
Well, another big one for us is diversity in clinical trials. I know we've been doing a lot of work to help recruit patients into clinical trials, especially diverse patients. We know that is an ongoing challenge, that a lot of studies are just based on one type of person, and that's not the way the real world is. Different people take drugs.
Definitely. So just to be clear, there's no pause as with the communications or anything like that. But what has folks up in alarm is there is a lot of discussion about reducing or eliminating DEI, diversity, equity, and inclusion standards and practices in the federal government and even beyond. And it's potentially as part of that. It's unclear. The Food and Drug Administration has removed pages from their website which provide guidance to medical researchers on conducting medical trials with representative numbers of men and women and ethnic and or racial minority groups. And so for us at GHLF, this is something that we have been strong supporters of, the idea of increasing diversity in trials. We have helped encourage this generally throughout the country. And I think most people know this. This is not a matter of symbolic diversity. This is, as you just alluded to, many medications and or diseases or conditions present differently in men and women and in people with different genetic backgrounds.
Yeah, it's like we know this is an ongoing challenge in areas of research. And we talk often about, I'm like hesitating with my words because it's just like, it's hard to wrap my head around this one. We talk a lot about, uplifting voices of different communities and building trust with communities. And I think it says a lot when people at the top are posting resources that helps people feel seen, because they see themselves in these higher up places. And to take that away, I know it just like has an impact of like, maybe I don't really belong here and I don't belong in these spaces, and kind of alienates patients from participating in research.
And beyond that, again, going back to what I said earlier, this is not about symbolic diversity, but I would argue necessary diversity to know how emerging therapies respond to people of different backgrounds. But also equally as important is that scientists have focused on the issue of diversity in clinical trials because of a lack of a diverse population can lead to skepticism from patients who would be helped by medications. And unfortunately, there's a sad history in our country of using, abusing, mistreatment of minority groups when it comes to medical research. And as a result, there is a mistrust in certain communities that needs to be overcome when developing new therapies. And that is important and is an important rationale for increasing diversity when it comes to clinical trials.
Absolutely. And, other resources we saw taken down was Spanish language content, LGBTQ+, and HIV resources. So it just makes our job more important than ever to continue to put out the right information and support these communities so that people can have the right resources so they can have informed conversations when they meet with their doctors.
Yeah, absolutely. Absolutely. Well, That was a lot, and we're not done by any means, but we'll take our own full pause right there on external communications because, we need to catch our breath, frankly. But more happened. The United States has left the World Health Organization, and as we're recording, RFK is preparing to go to Capitol Hill for his nomination to become HHS Secretary. So there's a lot more to come, a lot more that we'll be discussing in the coming weeks and months and years. Oh my gosh. And, hopefully there'll be a lot of good things as well. There are some positive movements on legislation on Capitol Hill for bills that we believe will be helpful to patients in terms of gaining access and affordability for medications. So that's something that we're going to keep our eye on and keep informing everyone of. So let's take our pause there and come back next week.
And I guess with that pause, just remind everyone that we have our 50-state network of advocates. So, if you're feeling inspired to share your voice, share your story, definitely email us at advocacy@ghlf.org to get involved with our advocacy network.
Excellent. Well, before we go, we want to encourage everyone to check out all of our podcasts at ghlf.org/listen.
Well, everyone, thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you liked this episode, give us a rating, write a review, and hit that subscribe button wherever you listen. I'm Zoe Rothblatt.
I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.